Imagine the white part of your eye is like the tough outer shell of a baseball. Now imagine that shell gets inflamed, like a deep bruise that just will not quit. That is the basic idea behind scleritis, and it can go from annoying to serious fast. Scleritis is inflammation of the sclera, which is the strong white wall of the eye that helps it keep its shape. Unlike a mild surface irritation, scleritis tends to feel deep, intense, and stubborn, and it can be linked to problems happening elsewhere in the body. In this video, we will walk you through the symptoms, causes, diagnosis, and treatment, so you know what this condition is and when it is time to get help. The most common symptom people notice is a deep eye pain that can feel sharp, meaning it feels like it drills inward instead of scratching on the surface. The eye often looks very red, and the redness may not just be a small patch, but spread across a bigger area. Some people also get light sensitivity, tenderness when they touch the eye area, watery eyes, or blurry vision. Here is an easy way to think about it. Dry eye or mild irritation can feel like you have something in your eye, like a grain of sand. Scleritis is more like the whole eye feels sore from the inside, and it may hurt even when you are not blinking. If you have a painful red eye with worsening pain, blurry vision, or pain that wakes you up, that is a reason to take it seriously and get evaluated quickly. A lot of scleritis cases are not caused by germs. Instead, they are driven by inflammation from the immune system, and scleritis can be associated with autoimmune diseases like rheumatoid arthritis, inflammatory bowel disease, lupus, or certain types of vasculitis, which is inflammation of blood vessels. Sometimes the eye problem is the first obvious clue that something systemic is going on. Less commonly, scleritis can be infectious, meaning caused by bacteria, fungi, or other microbes, and that matters because the treatment approach can be totally different. This is one reason you never want to self-diagnose and treat a painful red eye with leftover drops, especially steroid drops, because the wrong treatment can make an infection worse. Diagnosing scleritis usually starts with an eye exam, and an ophthalmologist will look closely at the eye to confirm whether the inflammation is in the sclera rather than just on the surface. If the inflammation is in the back of the eye, called posterior scleritis, it can be harder to spot and may require imaging, like an ultrasound, because the redness you see on the outside might not tell the full story. Because scleritis can be tied to autoimmune disease, your eye doctor may coordinate with your primary care clinician or a rheumatologist, and they may recommend blood tests based on your symptoms and history. The goal is not just to calm the eye down, but to find out whether there is a bigger underlying cause that needs treatment. Treatment depends on the type and severity. For many non-infectious cases, doctors often start with anti-inflammatory medicines, and if that is not enough, treatment may escalate to corticosteroids and sometimes other immune system calming medications when the inflammation is severe, recurring, or connected to systemic disease. If an infection is suspected or confirmed, treatment shifts toward targeted antimicrobial therapy, and sometimes surgical steps are needed depending on the situation. The key point is that scleritis is not usually a wait-it-out condition. It is a get the right diagnosis, then treat it correctly condition. So that is scleritis. It is inflammation of the tough white wall of the eye. It often causes deep pain and significant redness, and it can be linked to autoimmune disease or, less commonly, infection. If you take one thing from this video, let it be this. A painful red eye with deep aching pain or vision changes is worth urgent medical attention. If you found this helpful, consider subscribing for more clear, visual explainers on eye health. Thanks for watching, and I will see you in the next one.